In many chiropractic offices, front desk teams are managing a workflow that wasn't built for them. Even with talented staff, the specific requirements of this specialty create an administrative burden that is difficult for generalist teams to keep up with. This chart shows the scale of that burden using data from CMS. While most Medicare Part B services have an improper payment rate under 10%, chiropractic services sit at 33.6%. CMS found that 95.5% of those improper payments are caused by insufficient documentation, a process problem, not a clinical one. The daily result of these documentation gaps is that roughly 30% of claims are denied. That's nearly triple the national average for most other outpatient specialties. This data suggests that chiropractic billing is a technical specialty, and managing it with general-purpose in-house staff often leads to unnecessary revenue leakage. To understand why these denials happen, you have to look at the mechanics of the coding. Chiropractic billing is governed by its own CPT family and a strict maze of payer policies. Take the core CPT codes, 98940, 98941, and 98942, which are tiered by the exact number of spinal regions treated. Missing a single treated region is undercoding, an oversight costing providers between $2,000 and $5,000 in uncollected revenue every year. Then there's the AT modifier. For every Medicare claim involving spinal manipulation, this modifier is mandatory to indicate active treatment. Missing those two letters causes Medicare to automatically reject the claim. In fact, improper modifier use accounts for 31% of all chiropractic claim denials. This environment is under increasing scrutiny. From 2022 to 2024, chiropractic audits increased 47%, with auditors frequently looking for documentation that justifies active treatment over maintenance care. Maintaining the level of training required to navigate these rules is a significant overhead cost that many small and mid-sized practices find difficult to sustain in-house. Many practices experience a staffing spiral, investing months into training a biller on these specific modifier rules, only to see them move to larger health systems or remote billing companies for higher pay. When you combine the median salary of a medical biller with benefits, payroll taxes, and training overhead, the real cost of a single full-time employee often exceeds $55,000 per year. That investment is further eroded when staff become overwhelmed. Data shows that 65% of denied chiropractic claims are never reworked before their filing windows expire, meaning that money is never recovered. Smart practices are addressing this by moving to a dedicated outsourced model, specifically with Staffingly, a team that works exclusively on chiropractic billing. This shift replaces a high-turnover in-house system with a permanent infrastructure designed to catch errors before they lead to permanent revenue loss. Staffingly's model relies on credentialed specialists who are tested on chiropractic-specific CPT codes and Medicare modifier requirements before they ever touch a claim. Implementation happens within a 14-day go-live window. The team integrates securely into your practice's existing EMR, following your specific workflow and payer mix every day. On a daily basis, these specialists use clean claim checklists to verify region counts and subluxation documentation, ensuring the files meet the requirements that auditors look for. Staffingly layers predictive AI tools over this human expertise. These tools automatically flag claims with a high risk of denial or missing modifiers before the submission is sent to the payer. By combining human oversight with automated audits, the system identifies the types of microscopic errors that are often missed at high volume. This workflow causes a measurable drop in errors. Staffingly's client base error rate stays consistently below 1%. Contrast that with a $55,000 in-house employee. Staffingly provides specialized coverage for $399 per week, which drops to $349 at volume. For less than half the cost of one generalized employee, you get a system that includes HIPAA and SOC 2 compliance and removes the risk of staff turnover. The engagement is month-to-month with no long-term contracts, and it begins with a 14-day risk-free pilot so you can evaluate the accuracy of the team yourself. If your denial rates are high or your billing staff is a constant source of stress, it's time to look at the data. Look at 30-minute discovery call to see what a specialized team can recover for your bottom line.